The reality of the opioid crisis is that it's here. It's very present. We see opioid response calls every single day. Whether you're high income, low income, somewhere in the middle, it's not really something that we can pretend is not affecting every single one of our community members. Typically, it's folks that were either prescribed a medication or are using another substance, like fentanyl is probably the most common one that we see now.
Fentanyl is one of the biggest public hazards to our community right now and is responsible for 80% of the overdoses that we see in Whatcom County. It's showing up in fake pills, and even a small amount of fentanyl is enough to stop somebody's breathing.
There has been a little bit of reduction in the overdoses, but it's still a big problem and still a community health issue. So our first response was to increase the amount of Narcan or naloxone that's going out in the community. It's showing now that there are positive results, and we need to keep doing that.
So a little bit about Narcan. Somebody that is overdosing, if you use Narcan on them, it can reverse the overdose. And it has saved so many people's lives, which is incredible. I'm so grateful for Narcan.
Narcan is safe, easy to use, and available to everyone. There are very few things that we can give a medication and it completely fixes the problem, and this is one of them.
Overdose deaths had been spiking in previous years and had even doubled, but the first few months in 2025, we've seen a sharp decline by 30% in overdoses from opioids. So we believe that our distribution of Narcan is beginning to have an effect.
Overdose situations of all varieties, but especially for opioids, are an incredibly common call for our EMS providers to take care of. Really, it's that initial few minutes that makes the difference between life and death. And as soon as we can get there, we can make a difference.
We're there quickly. We have the Narcan on board. We recognize it. We're trained how to treat it. First place we really need to start is establish if the person is awake. And then they look at their chest. If they're not awake, if their chest's not going up and down, we will assist their breathing. And if they know it's an overdose, we're going to go ahead and move into our Narcan administration, either by IV or by nose.
So the next process is that we really encourage people to go to the hospital, because the hospital is now offering medication overuse disorder therapies by the way of a medication called buprenorphine.
So buprenorphine, the reason that you'll hear people talk about this medicine is because if you have an issue with addiction to opioids, this helps people recover faster. It basically works the same way an opioid does in the brain. It kicks off all of the opioids off of your opioid receptors in your brain and replaces them with buprenorphine, which doesn't give you the same kind of high effect, but it stops the craving.
Yeah, I'd like to emphasize the fact that if you have an overdose, there is a state law that says that you cannot be prosecuted for calling 911, even if you have drugs on you, because it's important for the patient to get resuscitated. And then even if you go to the hospital, there's not going to be a law enforcement element to that. And once again, back to what the hospital services are offering, there is an ability for a social worker to engage you, and also a substance use disorder navigator that if you choose that you want to go into an intake program or MAT program, that SUD navigator will help you get there. And so while EMS, is the front line and providing that initial engagement with the patient, resuscitating them, getting to the hospital, there are many other factors that play into this. Stigma is a big one.
Empathy and substance use disorder just go hand in hand, because I think there's so much stigma. Every single human deserves dignity and respect, no matter what our journey looks like. And so many of the folks who use substances have so much trauma. And I just think the way that we can do anything productive is with kindness, with compassion. And as humans, we crave that. We crave people wanting to be with us, people listening to us, people acting as if we care and we matter, because we do, all of us do, and we all bring something good to the table. And I do want to try something different. It is possible, and there is hope. There's always hope.